Dr. Peterson and Nurse Carol Mitchell faced a critical case from the emergency room, just 30 minutes after completing a grueling 6-hour heart surgery. Dr. Peterson's eyes were watering from exhaustion, and his hands had started trembling. "Carol, this case can't wait. There's a risk of cardiac arrest," he said breathlessly. In the middle of the surgery, Dr. Peterson's knees buckled and he collapsed to the floor. The patient's heart was beating irregularly on the monitor, blood pressure dropping. At that moment, Carol did something very different from the panic around her. She maintained her composure and stepped up to the operating table. "I will complete the surgery," she said with determination. The other nurses looked at her in shock. "Carol, you're a nurse, not a surgeon." But Carol had already taken the scalpel in her hand because the operating room wasn't a foreign place to her. And in the next 2 hours, everyone at St. Mary Hospital would learn who Carol Mitchell really was. Because some people wear nursing uniforms, but actually have surgical training. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments what city you're watching from and hit that subscribe button. Carol Mitchell was St. Mary Hospital's most reliable operating room nurse. The 33-year-old blonde had been working at the same institution for 3 years. She delivered flawless performance in every shift, systematically prepared surgical equipment, and maintained perfect coordination with doctors. With her golden blonde hair neatly tucked under her surgical cap, Carol maintained professional distance while still conveying warmth in her approach to patients. Her blue eyes carefully followed every surgical procedure, and the steadiness of her hands gave confidence to the doctors. Carol's surgical team consisted of Chief Physician Dr. Peterson, anesthesiologist Dr. Williams, and assistant technician Lisa Rodriguez. Peterson was a respected 45-year-old doctor specializing in cardiac surgery with 15 years of experience. Williams was a meticulous 38-year-old specialist who had been administering anesthesia at St. Mary for 9 years. Carol's surgical approach was far above standard nursing protocols. During preoperative preparations, while others performed routine checks, she organized surgical instruments with military discipline, planning every detail in advance. "Where did you learn this precision?" they would ask. "Experience," Carol would say briefly. Carol's equipment management was distinctly different from her colleagues. She would check surgical instruments as if preparing for war, organizing emergency supplies as if preparing for a critical operation. "We're just nurses, Carol, not commandos," they would joke. Carol Mitchell had joined the Army at age 19. She had lost her father to a sudden heart attack during her childhood years. That day, she made a promise to herself. "I will get the most advanced surgical training." When she joined the Army, she chose the Field Surgical Specialist program. After basic military training, she was selected for special surgical training. Army Field Surgery Program, a 20-month intensive surgical training process, surgery under combat conditions, life-saving with minimal resources, surgical operations under enemy fire. Carol was selected for the top 3%. "A field surgeon isn't just a medical specialist," her training commander had said. "You're the person making life-and-death surgical decisions. Even under bomb explosions, you'll be operating on wounded soldiers." The most challenging part of her training was surgical operations in combat zones, surgery under enemy attack, performing complex surgical interventions with basic tools. Carol had gained extraordinary skills in these areas. In her first deployment, she was at the Forward Surgical Hospital in Afghanistan. Surgical operations in combat zones, operating on wounded soldiers after explosive attacks. Carol's most critical intervention was saving a lieutenant severely wounded in a rocket attack. In her second deployment, she was with the Combat Surgical Support Team in Iraq. Surgical support in urban warfare, emergency surgeries after insurgent attacks. The techniques she learned in these deployments were methods never used in civilian hospitals. Her third deployment was classified surgical operations at the Syrian border, surgical assistance in covert operations, medical support for special forces. Carol had now gained surgical expert-level competency in all types of geographical and operational conditions. Over 11 years, Carol had successfully completed 203 critical surgical operations. So why had she left the Army to become a nurse? This story was more complex: PTSD, adaptation problems, civilian life challenges. Carol's transition hadn't been easy. High-pressure surgical work felt familiar, but civilian procedures were different, and this tension would emerge that day. After receiving an honorable discharge in 2021, Carol had transitioned to the civilian healthcare sector. She used PTSD rehabilitation, adaptation counseling, and career transition support. Operating room nursing had been an ideal choice. When St. Mary Hospital hired her, Carol was overqualified. Nursing degree, 11 years of military surgical experience, field surgery certificate. But the hiring committee hadn't asked detailed questions. "I've always wanted to work in the operating room environment," Carol had said, and this time she was completely sincere. Daily work was comfortable compared to combat surgery, surgical preparation, doctor assistance, patient care. But Carol was doing much more. She evaluated every case from a field surgeon perspective. "Carol, how do you understand surgical procedures so well?" her colleague Lisa would say. "Observation," Carol would say. "Every surgery is educational." When her Tuesday evening shift began, St. Mary Hospital had an intensive surgery schedule. The cardiac surgery department had 3 complex operations planned consecutively. Dr. Peterson and Carol had started working non-stop from 8 a.m. The first surgery was completed in 4 hours. Bypass surgery, successful. The second operation took 2 hours. Valve replacement, flawless. But the third surgery turned out to be much more challenging than expected. 58-year-old David Morgan's heart had damage at 3 different points. Complex reconstruction surgery was required. Dr. Peterson and Carol worked for 6 hours without stopping. When the surgery ended, it was past 9 p.m. Dr. Peterson was exhausted. His hands had started trembling from fatigue. "Carol, we've done 13 hours of non-stop surgery. We need to rest a bit." Right then, an emergency room call came in. "Dr. Peterson, we have an emergency heart attack case coming. Ambulatory cardiac arrest. Immediate surgery required." Dr. Peterson rubbed his eyes. His fatigue was visible. "How urgent?" "Life-threatening. ETA 15 minutes. "Let's prepare," said Dr. Peterson, trying to stand up. Carol assessed the situation. Peterson's condition looked risky, but the patient couldn't wait. When 45-year-old Robert Smith arrived by ambulance, his condition was critical. Massive cardiac arrest, multiple vessel blockage, immediate bypass surgery was required. When Dr. Peterson entered the operating room, his steps were staggering. "Carol, this case can't wait. There's complete coronary occlusion," he said while having difficulty breathing. The surgery began. Dr. Peterson made the first incision, but his hand was trembling. The effect of 13 hours of non-stop work was obvious. "Doctor, are you stable?" Carol asked with concern. "I'm fine. Let's continue." But Dr. Peterson wasn't fine. His eyes were blurring. He was starting to sweat. At the most critical stage of the cardiac bypass procedure, his hands lost control. "Dr. Peterson." Peterson slowly staggered and collapsed to the floor beside the operating table. Exhaustion, collapse. The operating room panicked. Anesthesiologist Dr. Williams immediately began treating Dr. Peterson. Severe dehydration and exhaustion, immediate rest needed. Lisa was in panic. "What are we going to do with the patient? The surgery is half finished." Robert Smith's heart was beating irregularly on the monitor, blood pressure dropping. They were left without a doctor in the middle of open heart surgery. "The nearest cardiac surgeon is 45 minutes away," said Dr. Williams. "But Robert can't wait. There's cardiac arrest risk within 10 minutes. At that moment, Carol did something very different from the panic around her. Maintaining her composure, she stepped up to the operating table. "I will complete the surgery," she said with determination. Dr. Williams looked at Carol in shock. "Carol, you're a nurse, not a cardiac surgeon?" "I know what I'm doing," said Carol while putting on surgical gloves. Lisa screamed in panic. "Carol, this is cardiac bypass surgery. You can't do this." But Carol had already begun organizing the surgical instruments. Her 11 years of field surgery training automatically kicked in. This was her expertise. "Dr. Williams, continue anesthesia monitoring. Lisa, keep surgical instruments ready. I'll complete the cardiac repair. Carol, this is impossible, said Dr. Williams. Cardiac surgery requires years of specialization. Carol looked at the open heart in the patient's chest. Multiple blockages in coronary arteries, cardiac muscle damage. Complex reconstruction was needed. Dr. Williams, said Carol calmly but decisively, I know cardiac surgery, trust me. Carol took the scalpel in her hand. After 11 years, field surgery training was reactivating. But this time it wasn't a battlefield. It was a civilian operating room. Continuing coronary bypass, said Carol. Lisa, suction and retraction. Dr. Williams, cardiac rhythm monitoring. Carol's hands began working with surgical precision. Every movement was calculated. Every cut was professional. She located cardiac vessels, identified blockages. How is this possible? Lisa whispered. Carol didn't answer. That night in Afghanistan came to mind. Open heart surgery after a rocket attack, minimal equipment, maximum expertise, successful operation. First bypass graft completion, said Carol. Second vessel access. Dr. Williams just watched. Carol's surgical skill was incredible. While Carol managed the surgery, she also coordinated the entire team. Lisa, surgical instrument inventory. Williams, blood pressure and cardiac output monitoring. This came from field surgery team leadership training. Surgical leadership under extreme conditions, resource management, critical decision-making. Carol, said Dr. Williams, you've done this before. Yes, said Carol, focusing on cardiac repair. Under much more difficult conditions. Lisa looked amazed. Carol, this isn't normal nurse performance. Are you a surgeon? Carol hesitated. It was time to break 3 years of secrecy. While the surgery continued, she began to speak. I served 11 years as a U.S. Army field surgeon specialist. 3 deployment periods, Afghanistan, Iraq, Syrian border. Complete silence in the operating room. Field surgeon, said Dr. Williams in disbelief. You were a military surgeon? Advanced cardiac surgery, battlefield conditions, trauma surgery, emergency leadership. Lisa's eyes widened. Carol, you were a special forces surgeon? 2 hours later, Carol was placing the final sutures. Robert Smith's condition had stabilized. The cardiac bypass surgery had been successfully completed. Operation completed, said Carol, removing her gloves. Patient's vital signs stable. Dr. Williams examined the surgical results. This is extraordinary cardiac surgery performance. Perfect technique. Lisa was still in shock. Carol, this is incredible. You're a real surgeon, Carol answered while washing her hands. In a different context, now I'm a nurse. No, Carol, said Dr. Williams, you're a legend. The next morning, there was major change at St. Mary Hospital. Carol's story had reached hospital management. Chief Medical Officer Dr. Thompson called an emergency meeting. Carol, last night's performance was extraordinary. Thank you, Dr. Thompson. But I need to learn about your real background. Carol explained her situation. 11 years of military surgical experience, battlefield surgery expertise, combat surgical leadership. Dr. Thompson was amazed. Why are you working as a nurse? Because I want to serve people in civilian life. Rank and title don't matter. Carol, you're our hospital's most valuable asset. Would you manage the advanced surgery department? Carol hesitated. I'd prefer to stay in patient care. When Robert Smith's family learned about Carol's story, they came to the hospital. Ms. Mitchell, said Robert's wife Sarah Chen, I don't know how to thank you for saving Robert. I just did my job, said Carol. No, said Robert's son. The doctor said under normal conditions the risk of losing Dad was very high. Your surgical expertise saved him. When Robert woke up, he saw Carol. Are you the nurse who saved me? Yes, Robert. How are you feeling? Very good. This nurse was a real hero. Carol smiled. You're very strong too, Robert. After Dr. Peterson recovered, he told Carol's story to the entire surgical department. Carol's story also caught the attention of other hospitals. She began providing emergency surgical training. Emergency surgery isn't just equipment, she would say in her training sessions. Adaptability, improvisation, alternative surgical solutions. Most importantly, never give up on the patient. But you're a field surgeon. We don't have that kind of training. Military surgery teaches you adaptability, life-saving surgical solutions in any emergency. The same principles apply in civilian surgery. Carol's training program: emergency surgery with limited resources, surgical team leadership, crisis surgical management. Carol was still working in the same nursing position at St. Mary Hospital. Robert had completely recovered and returned to his normal life. Carol's greatest achievement was the sense of confidence she gave to hospital staff. "As long as Carol is here, we can handle any surgical crisis," Dr. Williams would say. One day, hospital director Roberts asked Carol, "Carol, do you ever regret leaving your big military career?" Carol watched the team working in the operating room. They were providing surgical care to patients, saving lives. "No, Roberts. I protected soldiers for 11 years. Now I protect civilians. Same mission." Carol pointed to the patients. "Yes, the life-saving mission never ends. Only the location changes."